Russia calls it relief for the world. These shipments contain the vaccine candidate Sputnik. 2,000 Venezuelans will try it out, including a member of the presidential family.
In
this clinical trial phase, my son, Nicolas Ernesto Maduro Guerra, told me of his decision to be vaccinated with the Russian vaccine, to join the trial. I think it's very good.
Belarus was the first foreign country to receive batches of the vaccine last week. India is also interested in testing it. For Russia, it could be a Sputnik moment, like the one in 1957, when the communists launched the first satellite. In August, Russia declared itself the first country to approve a coronavirus vaccine. High-risk groups have been receiving Sputnik V, health workers, journalists, teachers. Alongside China, Russia's been deploying the shots before full efficacy trials are complete. The results are promising, but the vaccine has been met with some skepticism.
Washing his hands multiple times a day, just one of a series of hygiene measures Semyon Galperin undertakes. The doctor doesn't want to take any chances with coronavirus, but he knows a vaccine would offer the best protection against COVID-19. That's why he's volunteered to take part in testing a new Russian one. Someone has to do it. Without clinical trials, there are no medicines. The effectiveness of a vaccine can only be evaluated in the third phase of clinical trials. Stage 3 of the trials began a month ago, but the vaccine, which has been named Sputnik V, was licensed already in August before they began. Mass inoculation in Russia is planned for later this year, something numerous experts have sharply criticized. The Russian government rejects the criticism. It says the vaccine has been developed from already known substances and doesn't pose any health risks. Russia urgently needs an effective vaccine. The country currently has the 4th highest number of coronavirus cases worldwide, and the numbers continue to rise, with around 6,000 new infections each day. Galperin and other doctors working say they are not worried about the vaccine's safety. After all, the vaccine has already been tested on several well-known public people, and they're doing quite well. These public figures include Russian Defense Minister Sergei Shoigu, Moscow Mayor Sergei Sobyanin, and one of President Vladimir Putin's daughters. Important PR material.
It's part of Russia's strategic interests to always want to be first, irrespective of whether it's a revolution or the first flight into space. Now it's about saying that we're the first to develop a vaccine. Internally, we're showing that the situation is under control. Externally, it's a signal that Russia is still mastering its role as savior of the world.
Semyon Galperin isn't thinking about his country's PR plans just now. The doctor is here because he's hoping to help win the fight against the coronavirus pandemic. People are tired. They want it to be over. The new vaccine would help calm people and offer a way out of the situation. It will most likely be at least several months until the results of the phase 3 trials are known. Only then can the actual effectiveness and safety of Russia's Sputnik V vaccine be assessed.
Noah Bartsev works at the International Vaccine Access Center at the Johns Hopkins Bloomberg School of Public Health. So, will the Russians be the first?
Look, there are lots. We want lots of people to achieve a vaccine. It's not about who's going to be first. It's about as many people as can cross the finish line, really, to have a safe and effective vaccines. We want multiple winners here. The Russian vaccine is certainly, moving into large-scale phase 3s, as are many others. And we want licensure to occur after the completion of those phase 3s, when we have good safety data and good efficacy data that the vaccines actually work. So lots of people we want to succeed here, not just one group over another.
On the point of safety, have the Russians been fudging the numbers, as some have accused, and skipping parts of the trials?
There's no good solid evidence that there's been any concern about the numbers. The detail that was given in the Russian papers, the paper was excellent. The quality of the evidence was as solid as any of the other published papers. There have been some lay reports on blogs and so on. Those really don't hold water when examined thoroughly and statistically. So no, I don't have any more concerns about this group than any other group, particularly, no.
Now, the modified common cold viruses behind such vaccines have been studied for decades, but are still not widely used. Why is that?
There are a number of other vaccine platforms that we have a lot more experience with. The advantage of adenovirus vectored vaccines is that they are potentially capable of delivering almost any antigen to the immune system, and so and the vector itself is designed to be non-replicating, so it can't cause infection. The capacity to do that, the capacity to develop these vaccines has been in development for quite a long time, but only recently has it reached licensure under the pressure really of developing a vaccine against Ebola virus, and that's been a success. So that's good, and we'd like to see more of these vaccines going forward. Clearly we need lots more experience with them, particularly around safety and around efficacy, but there's no reason to suspect that there'll be problematic vaccines. In fact, they're likely to be very good vaccines. When you have a range of potential adenovirus vectors, some are more frequently encountered by human populations than others, then there are differences potentially that could arise among the different products, and that's some of the detail that's coming up from some of the scientific literature. But as a platform, it's a really exciting platform, and we hope that there'll be lots of opportunity to develop this platform with vaccinology beyond this pandemic into the future also.
What's the certainty, though, that vaccines that pass phase 3 will be successful for the wider population?
There's never certainty. Science is built on uncertainty and falsifiability. So it's really important that our methods are as rigorous as they can be. And it's important that we continue to evaluate the vaccine even after it's rolled out and even after it achieves licensure in phase 3. Phase 3 trials are the trials that demonstrate large scale, in terms of tens of thousands and collectively close to hundreds of thousands of people, safety in trial participants, and importantly, efficacy against disease. So it actually protects human beings against disease. That's the minimum that we require for licensure. If a vaccine is very rarely harmful, it causes serious harm very rarely, then society has to weigh up the pros and cons. As with all vaccines, they all are potentially harmful, but very rarely so. But they're very, very beneficial, and frequently so. So it's always a question of balancing the risks and benefits. And that correct balance requires good science, good surveillance, and good evidence going forward beyond phase 3 and beyond licensure, well into many years of, hopefully, future use.
You've said it's problematic if a vaccine is designed to target the disease and not the infection. Why?
Well, it's not exactly right, but you're close. I mean, all vaccines really are designed to target disease. But clearly we're facing a complex situation currently with coronavirus because we have widespread infection and transmission occurring globally. I think the public expectation is that once a vaccine is available, we go back to the way things were and we stop masks and we stop social distancing. And that's a misjudgment of what a vaccine, at least in the initial phase, can do. The aim of the vaccine is to reduce disease and to reduce it in vulnerable groups, at least initially in the first round of vaccination. If a vaccine is only given to those at high risk and not to everybody, clearly transmission will continue to occur in those who didn't receive the vaccine. But even in a year from now or a year and a half from now or 2 years from now, when the vaccine is more widely available, it'll be critical to demonstrate that it actually reduces transmission and not just reduces disease. Mm-hmm. Because if it doesn't do that, then the only other ways to reduce transmission are to continue with face masks and so on. One could imagine a paradox whereby if the vaccine continues to allow transmission and works less well to protect against disease in the elderly, that paradoxically adverse outcomes could get worse, not better. So we need to be very careful about how we deploy vaccines on the basis of the best available science and evidence around what they do, what their efficacy is against.
Noor Bartsev, thank you very much for joining us.
Thank you for having me.
And it's that part of the show when we look at your questions on the coronavirus. Here's DW Science correspondent Derek Williams.
Are any countries testing school-age kids on a wide scale too? If so, what are the results?
Because COVID-19, in general at least, doesn't affect children as severely as older people, kids in general have not been tested as much throughout the pandemic. It's simply been a question of resource allocation. But the lack of really solid data has also led to a lot of speculation that kids might not be much of a factor in spreading the disease throughout wider society, which has, in some countries, influenced things like decisions to reopen schools. But now, a big study from India could cause authorities to rethink that idea. It focused, among other things, on contact tracing data from 85,000 confirmed cases in 2 states there. In total, it looked at test results from over 500,000 contacts that occurred between people who were infected and the people they gave it to or didn't give it to. And one of the most interesting takeaways was that it showed kids actually do pass the disease on to other kids, especially those in their age group, which would include, for example, kids in the same class at school. What the study wasn't able to clarify was how often those kids subsequently might have passed the virus along to adults. But even so, the evidence now looks pretty compelling. It indicates that the idea that kids don't really spread COVID-19 doesn't really hold water, which a lot of researchers have said shouldn't actually come as a surprise.